Go ahead, ma'am.
Hi, good afternoon, everybody, and welcome for today's Facebook Live session. I'm Dr. Rashmi Niphadkar, and I'm the junior consultant at Oasis Fertility, Pune. Now, today we'll be talking about one of the most important aspects of your fertility journey, and that is your fertility reserve or your ovarian reserve. Now, and we'll also be talking about what is the importance of mapping this reserve for your fertility treatment. So let's start by understanding what exactly is an ovarian reserve. So, in the simplest of terms, it is the number of eggs that are remaining in your ovary at any given point of time. Now, ever since you're born, your eggs are on the journey of their own. In each menstrual cycle, what is happening is one of the egg from the many eggs from your ovary is going to grow. It is going to achieve its dominance. That means it's going to be responsive to different hormones in your body. Now, this dominant follicle is going to ovulate. This ovulated follicle will undergo fertilization when it meets the sperms at the right time, and this fertilized embryo is eventually going to implant in your endometrium and form a baby. So, this is the journey of your egg overall. Now, as a baby girl is born, it is born with around 1 to 2 million of these eggs. So, a lot of number of eggs, or what we like to call as the primordial follicles. But by the time you achieve puberty, you will be left with around only 4 lakh of these eggs. Now, out of these 4 lakh eggs, also you will be ovulating only about 400. So, overall, your eggs are on a journey of decline or a journey of atresia, or in simplest term, the eggs are dying over a period of time. So that is why it is very important to map your ovarian reserve, or what we like to call as in one point of time how many of your eggs are remaining in your ovary, which will be your future potential of fertility or your future babies. So that's why it's so important to map your ovarian reserve. Now, ovarian reserve has been mapped ever since the early 1980s, and many tests have evolved over a period of time. And we have these various assays of hormones that we can do. But over a period of time, we've realized that two of the tests are most important, and they are clinically proven over a period of time to be important predictors of your fertility. Now, which are these two tests? One is the antral follicular count, and second is AMH or anti-Mullerian hormone test. So let's look what your antral follicular count is, or what we like to call as AFC. So in simplest of terms, we do your ultrasonography, and in real time USG, we count the number of eggs that are in your ovaries. And by actually counting these eggs, we can typify your ovarian reserve as to is it low, is it a normal spectrum, or is it on a little higher spectrum. So if I do your TVS scan or a transvaginal scan, and I find the number of eggs that I can count is around 7 to 8 or less than that, I will call your reserve as on the lower spectrum. If I see these eggs and I count around 8 to 16, then I'll call your ovarian reserve as being a normal category. And if I count more than 16 or maybe 20 or 25, I am going to typify this ovarian reserve as a hyper responder or on the PCOD spectrum of reserve. So this is how we typify your ovarian reserve based on the antral follicular count done by a transvaginal sonography. So that's the first step in measuring your ovarian reserve. Now, what is the second test? The anti-Mullerian hormone or an AMH. And this is a blood test that we do. We measure your AMH levels in the serum or blood. Now, how is this AMH getting into your body? Remember the small tests, the small eggs that we talked about in your ovaries or the primordial follicles. Now, these small eggs are what are releasing anti-Mullerian hormone in your blood, and this is what we end up measuring. So, more the number of eggs, more will be your AMH levels, and less eggs will be less AMH levels. So it's a very sensitive marker of fertility, your serum AMH levels. It's a very good predictor of your underlying ovarian reserve. So suppose I find your AMH to be less than or equal to about 1.2 nanograms per milliliter, I will typify again your ovarian reserve as on the lower spectrum. If your AMH is around 1.2 to 3.5, in this range, I will say that your ovarian reserve is around about in the normal category. And if it is more than 3.5, I will categorize your ovarian reserve again as towards the hyper-responder category or COD category again. So these are the two most crucial tests. Now we also have a plethora of other hormonal assays that we can do to map your reserve. Some of them being your follicle stimulating hormone or your serum estradiol levels. But these are conjunctive tests rather than actual predictors, and a combination of your antral follicular count and your serum AMH levels is what is going to give me the best judge of your ovarian reserve. These tests are easily done, easy to apply, more cost effective. And just by doing these two tests, also, I can give an accurate, sensitive marker as to how your ovarian reserve is, or rather, which spectrum your ovarian reserve is lying. So, in this day and age, antral follicular count and AMH are two of the most important tests that your doctor may do for your ovarian reserve. Now let's come to the fact that why is mapping your ovarian reserve of such crucial importance? Wherever you go to a clinic to get any sort of fertility treatment, these tests are the ones your doctor is going to call for. So why so, and why are we trying to map your reserve in the first place? So there are two most important things why I want to know your ovarian reserve. And the first most important thing is because I need to map out a further line of treatment for you. So if you lie on the lower end of the ovarian reserve spectrum, I'm going to go and try and be more aggressive with your line of treatment. I'm going to tell you to try for a few months, but go more aggressively, go more IVF wise. Whereas if you lie in the middle, the average spectrum or the normal response of your ovarian reserve, we might tell you that you have some time. So, you can take it easy, or you can try naturally, or you can try maybe ovulation monitoring or more of IUI kind of treatment. And if I find you on a little bit of higher reserve or a PCOD spectrum, maybe we can tell you to get treatment for your PCOD first. Or maybe for you, if you're not ovulating because of your high reserve, we can go for ovulation induction agents or ovulation monitoring cycles or IUI, rather than directly jumping into any aggressive sort of treatment. So it gives us a good sort of viewpoint in which we can chalk your treatment. Your further line of management depends on your ovarian reserve. So this is one of the most important reasons why we will ask you to get your ovarian reserve checked. Now, the second most important the second most important cause why will we check your ovarian reserve would be because if we are going for IUI or if you're going for IVF and we are stimulating your ovaries, we need to know what sort of dose we want to start off with, or how do we want to taper off your dose, because that would depend on how much of eggs are available in the first place in your ovaries. That is your ovarian reserve. So by mapping your ovarian reserve, I know what dose to start you on, or how long to continue the stimulation, or how do I taper the stimulation for you. And of course, I also get a good judgment at the start of your stimulation, what to expect by the end of your stimulation. So if your reserve is low, I know what to expect at the end of your stimulation. Or if your reserve is very, very high, I know what the end result will be, and I can modulate your treatment like that. I can add other agents, other drugs, other medications that may help your eggs to grow if I know which spectrum you belong to, either a low reserve or a high reserve or a normal reserve. So I can modulate your treatment schedule likewise, your stimulation cycle likewise. So that is the second important reason why we need to map your ovarian reserve. Now, ovarian reserve testing is important if you are currently going for fertility treatment, but it will also be important if you are going to delay your treatment. If you want to delay your childbearing, maybe you want to get married late, maybe you want to have children later in your life, maybe you just want to map what your fertility is right now, so that you can take important life decisions later on in your life. So that is also one of the important things why you need to map your fertility today. So Also, any sort of surgery you want to undergo, any sort of health issues you are happening is happening with you, also you can map your fertility before any surgery, and then do it after your surgery, so you can get a good idea how your fertility is affected by a particular surgery. If you are going under any ovarian surgeries, you can map, how your fertility has it declined after the surgery or no. So all these are important guidelines or mark posts. Your ovarian reserve mapping would be an important guideline for all your future decisions, for delaying your childbearing, for any sort of surgery. If your partner is unavailable for fertility treatment, also you need to map your fertility reserve, so you know and you have information in your hand about your fertility. And that is an empowering thing, because you can take so many decisions with your life knowing your fertility reserve. So these are all the different reasons why you should get your fertility reserve checked, whether you're doing a fertility treatment today or whether you're going to do it later on in your life, doesn't matter. It's also a good idea to always a good idea to check your fertility reserve. So that's it about fertility or ovarian reserve for today, and we'll be happy to take on any questions about your ovarian reserve. Our centers are located in Kharadi as well as Wakad. And you can dial down our helpline if you want to have any more information about your ovarian reserve, or you can dial down, or you can come down directly at our centers as well. Thank you. So the first question is, what does an ovarian reserve test tell you? So I mentioned at the start of this Facebook live that the ovarian reserve is the number of eggs remaining in your ovary at any given point of time. So it's just the number of eggs that we can count and we can map via blood test. And these are the eggs that are your future babies. So what we are mapping is your fertility potential. What is your fertility potential right now as of today? So that is what your ovarian reserve test will tell you. What is a good AMH level for fertility? Okay, so an average AMH level is somewhere between 1.2 to 3.5. This would be a normal, and this is nanograms per milliliter. So the even the connotation is important, because different labs will have different sort of cutoff values. So whenever you do an AMH level in the lab, always look for the cutoff value, because these values may change. So a good AMH level is 1.2 to 3.5 nanograms per ml. Lower spectrum is less than or equal to 1.2 nanograms per ml, and the higher spectrum or the PCOD spectrum will start at around 3.5 nanograms per ml. But of course, lab to lab variation is there, so it's better you look at the lab testing parameters. So that's about the AMH levels. How does low ovarian reserve affect fertility? So, basically, low ovarian reserve means that the number of eggs that you have in your ovaries have reduced. As I said, ever since you're born, your ovarian reserve is on a continuous decline. So, a low ovarian reserve means you are on the lower end or the lower spectrum of your fertility, and that means that you need to go a little more aggressively with your fertility treatment, because after 6 months, if you check your AMH, you will again find a dip in it, or your antral follicular count. If you count your eggs, you will find a dip in the count. So as your age progresses, as time progresses, you will only find a further decline in your ovarian reserve. So if at any given point you know that your ovarian reserve is less, that just means that you need to go aggressively with your treatment. You need to consult with your doctors, and you need to come up with an aggressive plan of your fertility. How can I improve my ovarian reserve? That's a great question. So, unfortunately, as of today, there is no proven scientific method to improve your ovarian reserve, because there is nothing that has been proven that will increase the number of eggs that you have in your ovary, right? So, but you can restrict the decline of your ovarian reserve by having good sleep, having good nutritious food, having a good mindset, reducing your stress in your life, having good moderate amount of exercise, all these factors will actually help your ovarian reserve not improve but just stay where it is. And all these factors, if you're on a fertility treatment, they will also help your fertility treatment positivity rate. So very important things, like reducing your stress, having good food, getting good sleep, taking less stress in your life, giving your body good exercise, all these things will help your eggs. Quality of the eggs will improve. Your ovulation will improve. Your implantation may improve. So that's what you can do. Right. So this is our fertility helpline number, and you can call us for any further queries or come down directly at our clinic. So thank you all.